Have you ever wondered what one of your largest expenses in retirement is going to be? Well, if you have, stay tuned for this FERS Federal Fact Check. Hi, I'm Micah Shilanski with Plan Your Federal Retirement. We have a good question that comes today that talks about a large expense you have in retirement. All right, but it's not your largest expense, but it's what people think is going to be their largest expense in retirement. People often come to me and says, Micah, health insurance or health expenses is probably one of the largest costs I'm going to have in retirement. And I can understand how that could feel that way. But I'm going to tell you that's probably not the case. Most of, if not all of the people I deal with, the largest expense that they're going to have in retirement is taxes. That's right, the IRS, right? The income taxes you pay is probably going to be your largest expense. But let's put that one aside for a future video. Let's talk about what we're concerned about being our largest expense, and that's your health insurance. Whether it's health insurance or paying for medical expenses, we have a good question that came in, and I get this question a lot. It says, I'm 65 now and still working, but when I retire in a couple years, I'm interested in keeping my monthly health insurance down. Is it more effective to keep FEHB only or get Medicare Part B? I know best would be both, but if I have to keep my monthly costs lower, that is a great question. Now, a couple of things that come into mind with this question. Well, number one is most of the time when we're thinking about this, you can get an FEHB plan with Medicare, and the FEH plan, when you get under Medicare, you can get one that works with it, and it's going to lower your costs. You can even get plans that have a reimbursement if you sign up for Medicare Part B. So most of the time what I do is I do encourage clients to get both. I do encourage them potentially to switch to another plan that works a little bit better with FEHB instead of, Blue Cross, standard and basic, and use those terminologies. We all know what they are, right? The standard is the kind of more premier one, and you have the basic plan. The FEHB, Blue Cross Blue Shield basic plan, actually has a reimbursement if you sign up for Medicare Part B, and it's a little bit less. There's also other plans like GEHA that work really well with Medicare. So a lot of times what I encourage clients to do is move to a plan that works really well. Keep in mind, by maintaining FEHB into retirement, you can always switch plans every open season, even in retirement. So if you happen to switch to a plan you don't like, you can go ahead and fix it next year. But I'm still a fan, as much as we can, of having both FEHB, Medicare Part A, and Medicare Part B. Do you like this content and you want to help other federal employees learn about their benefits? Then go ahead and share this out. Our goal is to help another 1 million federal employees with a retirement. We cannot do it without your help. If you want more information on your benefits, then visit our website at planyourfederalretirement.com. Take care.